everyone. I am Norie Gonzalez Garza, and I am the mayor here at the City of Mission, and I would like to welcome you to our very first podcast for the City of Mission. Using a podcast to inform our citizens about things that are happening in our City of Mission. My first thought was, well, let's highlight the EMS service. Without further ado, I'd like to introduce our guest today. We have Dr. Ivan Melendez. He's our medical director. We have Chief Mike Silva, and we have Joey Flores, who is our deputy chief. So, Dr. Melendez.
Thank you so much for giving me the honor and the privilege to be here today, of course, as well as to serve as your medical director for Fire EMS. And I'm honored and I'm grateful, and I think it's incredibly insightful that it's such an important series and podcast that you're planning to bring forth with the objective to let our community know what's going on, that you would highlight on your very first one, something related to healthcare, which of course is our personal passion, and to remind all our listeners that if you do not have health care or access to it, then you don't have the basic building block. So I'm honored, and I recognize the importance that you're giving our service, and I thank you for that.
Thank you. Joey.
Well, thank you for having me here. It is truly an honor to be here in this first podcast, and speak about the wonderful developments, within the Mission Fire Department, and of course the integration of our EMS services.
Very good. Chief.
Again, thank you all for bringing this podcast to light. I think it's very important for our community to understand the importance of EMS and what we bring to the table. And I think a lot of the table talk that we were going to be talking today, I think is going to help out a lot to help ease the minds of some out there that have some doubts about our EMS program. And I think we're going to have a real good discussion on this. And I'm very privileged to be here today.
Thank you. Mike, I know that you were probably at the ground level when we started thinking about having our fire-based EMS. Can you tell me about how we got started and how we got here today?
Well, it's a privilege to begin starting how this EMS program went off the ground, and it was just a bunch of guys getting together at the fire station and said, how can we improve our EMS system? Because we started seeing a lot of deficiencies out there with other private providers that we had, and who else more than your own firefighters to provide a service to our community that we love. We have our families that live here, we live here, and it's something that we took pride in. And so a lot of guys said, what can we do to go to school? What can we do to educate ourselves and make sure that EMS program got off the ground? And so it kicked off, and we pretty much educated our city council, our city manager, and that was also the time of COVID. We were in a pandemic, and we wanted to make sure that our community was very safe, that they ensured that what we had to bring to the table was going to be nothing but good quality care and compassion that we have for our city. So I'm very happy where we're at today, and so it brings me nothing but happiness and excitement where we're headed, and I'm sure we will discuss that more further in our podcast today.
Okay. Dr. Melendez, you actually were the medical director prior to our fire-based EMS. Is that correct?
Yeah, that is correct.
So can you tell us a little bit about the transition?
Absolutely.
Okay.
I think like 65% of the nation, Mission chose to move, like the other 65%, toward modernization with providing emergency medical services. And when I came to this program, I was fortunate to be invited. I really saw the same problems that we were seeing nationwide. I've been doing this for about 40 years. And the city of Mission was having very much the same similar problems and motivation to do their own government-based, city-based EMS program. It wasn't anything new. In fact, the needs and the identified difficulties and the resilience and, as we say in medicine, treatment plan, it was really universal, as a lot of other communities that I've seen. First and foremost, when I first arrived, and I had the privilege of seeing what the private providers were doing, I saw that there was a great amount of difficulty and transparency, and in fact, even data access. So it was very difficult for the city to analyze to see how much of cost is it? What service are we getting? In other words, cost versus quality, which of course is the responsibility of the elected officials to make sure what they're providing to our citizens is that it's at a good cost and a great quality. So it was difficult. We didn't have transparency, quite frankly, and we didn't have direct access to the data. So it was very difficult. In fact, historically, there had been a single bidder. It's very difficult when you have a single bidder, because what? Because you don't have any leverage to bid. You can't get a better price when there's only one customer. And so we were looking for a workforce stability, which obviously was not being provided. And the response time, especially during surge capacity times, just simply wasn't there. At times, units weren't even in our city as we're contracted out. And so we were noticing that we didn't even have a good idea of those crucial metrics that we use in this industry, which is response time and surge needs. And so it was difficult. It was difficult for the city to even have enforcement of those contracts. How were you able to audit, to perhaps fine, or even renegotiate when you don't have data, you don't have access to it, and you have only one bidder? And so it became quite obvious and quite clear to me, like every other city, 65% around the country, that when you have a service that is based on profit plus cost, like private companies, I own several private companies, and I'm looking always at cost and at profit margins. But cost and profit is quite difficult when you're taking care of human beings. And so going from a cost profit to cost quality, I think was the answer. And I think that's how we got here today. That's how the city of Mission said, you know what, it's time to reboot and let's move away from what we've been doing. What is the rest of the country doing? It became obvious it was the same problems being repeated, and we didn't have to reinvent the wheel, if you will. We just moved forward the way it's been going toward a government-based process.
Thank you, Dr. Melendez.
My pleasure.
And now we'll hear from Deputy Chief Joey Flores.
Well, like Dr. Melendez mentioned, getting an idea of what the startup cost, the upfront cost was going to be, like we really had some difficulty in trying to get some of that information, from the information that was made available to us. And we knew that going into this, the startup costs were going to be high. It's just like any investment into a business. You're going in and your initial expenses are going to be high. So we're trying to get an idea, see what we're looking at, so that we can present, to our council, and give them a business plan, if you will, of what we were looking at, our plan in, getting everybody trained, the equipment costs, the ambulances, the units, So we had a lot of difficulty in the beginning, trying to come up with some accurate estimates, if that makes sense. But thankfully there was available grant funding, and I believe it was the American Rescue Plan Act, the ARPA funds. And I think Chief Silva can go a little bit more into detail as how we were able to, or how our administration was able to help us out and secure some of those grant monies that were available.
Yes, I'd be glad to chime in a bit on the ARPA funds. The ARPA funds were utilized to purchase Medic 1, Medic 2, and Medic 3 with all the equipment on there. Usually, like Medic 1, first cost was $250,000. Then the second unit was about the range of $354,000. And Medic 3 was also around that range, about $360,000. Of course, not including all the equipment necessary, things that we need, like a hard monitor, your stretchers, your Lucases, and things of that sort that are life-saving equipment. So we were able to secure those funds with ARPA funds at no cost to the taxpayer. And then, of course, Medic 4 came along, and that was a great asset that we had with the Hidalgo County. We had an agreement, an MOU, that only allowed us to spend $10 per month, which is $120 a year, to have Medic 4. And so when we started going with all the units running with all the 4 units, we were able to secure additional units that we have today, Medic 5 and Medic 6, as our backup units to have proper rotation, proper maintenance for those pieces of equipment, because the revenues that we were bringing in back to the city when we first started, that gave us an opportunity to purchase those ambulances so that we could continue making this EMS program grow. And it has grown significantly, and we're very proud of where we're at today. But at no point did we have a burden on the taxpayer on regarding that. Some of the things that were little things that were, as the initial costs, were staffing. Obviously, we needed to have some staff. We needed to educate our firefighters to be cross-trained. We needed to send them to school. And there again, we had a tuition exemption based on the legislature. Legislature allowed us to have a tuition exemption for paramedics, EMTs alike. And so that helped us with the community as well at no cost to the taxpayer. And so we got free education at very minimal cost. And so that's where we're at today.
You know, and if I may add, Chief, I think that what some people that support a private venue as opposed to a government venue, no one can argue about community service being a prioritization. But what they do argue is that those private companies, as opposed to governmental companies, tend to have better equipment, better training, nicer apparatus, better ambulances. But that's not the case in our city. In our city, it was the right time, the right place, because we were able to secure funds that are usually not available. And without a doubt, in the community of our 12 hospitals that we have in our area, we are known for having the finest of ambulances, the finest of equipment, and quite frankly, the best trained medics. And so, right time, additional funds that didn't tax the local community, and resulted in something relatively unusual in that we're used to seeing government hospitals versus private hospitals. We're used to seeing government clinics versus private clinics. We're used to seeing government post office versus UPS. Well, this is one of those times where a government agency was actually able to secure better equipment, better apparatuses, better training, and quite frankly, a better system because it was the right time and the right place.
Yes, it was. Yes, it was. Joey, do you have any other comments about Emergicon? How about that? That's our billing service.
So going into this, we knew billing was going to be, a headache in and of itself. There's so many laws and regulations regarding billing, insurances, the types of insurances. So going into this, we knew it was going to be a headache. So right off the bat, we weren't going to deal with billing. So we contracted out to the company called Emergicon, and that's their specialty, municipal service EMS. That's what they focus on. They don't deal with private-based EMS. All they do is municipal-based, and we have been very pleased with the collections rates, with the revenues coming in. That really has helped up maintain sustainability of our services. And they answer every phone call, any questions we got. They've been very, very informative and helpful. And they really have provided an excellent service to us, and thereby enabling us to provide an excellent service to our community. So Emergicon has been nothing but wonderful, not only for the department, but for the city itself as well.
It's very complex, Mayor, but when you deal with different payers, whether it's Medicare, Medicaid, Blue Cross, Blue Shield, private pay, they're all in themselves a specialty in itself. But as you noticed in the reports that we've been giving the elected officials, there's no question there's been increased reliability and accountability by better oversight, by data transparency, and by public accountability, that a professional company that's dedicated purely on the legislative compliance process as well as the customer satisfaction process, which is us. So I don't think there's a doubt. I don't know what you think about the reliability, accountability, and the better oversight and insight that we're getting. But from my perspective, my oversight, it's gotten dramatically better.
I would agree 100%. I wouldn't disagree at any point that we've picked the best company out there in the state of Texas, and they're even expanding to other states. And so I would, argue or debate it with anybody else out there that would say, well, you're not collecting so much amount of revenues and it's costing us more money. No, that I would tend to disagree with that because we have the data to show, and we've proven it. We've had presentations at our city council. We've had the real data-driven documents that actually show that how much revenue we've brought in, how much collections, what's written off, what's not collectible. And so we're very proud with the numbers, and we're to the point we're almost self-sustaining our service. So There's no hidden gimmicks, there's no hidden agendas other than providing that care and making sure that the city benefits from it.
It's important to also bring out that all these companies, and a disclaimer, I used to own a ambulance billing company, and I can tell you for this, it's constant updates, constant up to date. So it's very difficult to have a mom and pop organization when the laws are changing so quickly, so dramatically. And not only that, the consequences of not following the law are significant, severe. And so the oversight, transparency, and accountability have been great. And as most finance people will tell you, you only get paid if, we only get paid if you get paid. Yeah. So because they're contracted out on a percentage basis, they work extremely hard to make sure that we capture as much revenue as we can. And a reminder that revenue is not our focus. Right. It is responsibility to the taxpayer. Quality is our focus. But it's difficult to have quality if there's no revenue.
That is correct. Oh, no, definitely.
Yes. We are essentially a not-for-profit business. No, we're not in the business of making money, but to that point, we're not in the business of losing money either. And EmergentCon has really helped us secure the revenues from the right payers, the different insurance companies, so that we can stay in business and continue providing high-quality service to our community.
Absolutely. Better equipment, better training, sustained funding, no ups and downs, capturing all revenue, financially accountable, and compliance.
Mayor, there's something that I would be remiss if I didn't mention it today for our citizens of Mission, is that we've cut response times more than 6 minutes ever since we got this program off. Cut off. We got it off the ground. We do have fire stations in all of our corners of and the middle of our city, and that enables us to have our units respond to the appropriate emergency. Not only that, we're very proud that we launched out our ALS engines, so that even helps us even get to the community even faster. And so we're very proud of where we're at, and to the citizens of Mission, these are great stats to show that having our fire-based EMS, your firefighters responding to the calls that come in, they're life-saving measures that we do each and every day. And we're very proud of the response times. That is something that we've been very successful at. And so I want to reassure the public that when you call 911 and you need our services, we will be there a lot faster than the national average, which is 10 minutes. And we're averaging about 6.5 minutes to respond, and even sooner with our engines that are responding from the fire stations.
I also like to add, when talking about the great service that we provide our citizens, that we have actually been recognized by several of the hospitals, surrounding hospitals, as being top-notch, life-saving system that right. We have in place. And I think it's been at least 4 times that we've been recognized in the last year or so?
For the past year, we've probably about 5 or 6 times.
Okay, there you go.
But, and that's okay, Mayor. I know you're a busy person, and sometimes we understand we're all busy, but we got to put it out there, right? Yes. We have the best medics that you can ever ask for. They're very well trained. We have 24 paramedics now. We have 32 EMTs. We have approximately 17 advanced EMTs, and we're still continuing to grow. And we're very proud of where we're at, right? We've been able to have successful rates, cardiac arrest, anyone who's choking, unable to breathe, recognize strokes immediately and taking them to the appropriate facility. We're able to recognize and perform life-saving measures when it comes to heart attacks. We've been recognized for all those things, and we're very proud to work with our partners, Mission Hospital, Rio Grande Regional, McAllen Heart, South Texas Health Systems, DHR. They're all been a big factor in our health program. So without them as well, our partners, our community would not be where it's at today. So we're very fortunate to have those people in front of us. So thank you very much for allowing us and giving us that opportunity for our medics to be out there and providing that care.
Thank you. Chief Flores?
I think this all drives one point home in that we don't have an EMS division within the department, but rather an integration, because our EMS services begin at the engine company level, now with the ALS engine companies. So, from that first arriving unit, you are going to start getting that, medically trained professional doing their patient assessment. So all in all, the entire department has become an EMS department, and we don't have a separate division, but rather this integration that has improved the overall services of our department.
Mm-hmm. And I think that's really important to note that the whole department is trained, because many times the fire department is the first at the site. So it is life-saving measures that take place immediately as soon as our engines get there, and so that's very important. And I think that has been instrumental in all the in the life-saving efforts that you have made and accomplished.
And we couldn't have done it without the support of our city council, our mayor, like yourself, our city management, because without them, right, this program wouldn't have gone off the ground. And of course, our community, who now sees what we do every single day, how they see our lights and sirens going up and down the streets every single day, 24 hours, 7 days a week. It's nonstop. These guys sometimes have no sleep, as what we call Team No Sleep, but that's okay for them, right? Because they believe in the main objective, and that objective is to make sure they get that patient to the right appropriate facility so that they can continue being with their loved ones. So again, thank you, Mayor. Thank you to the council, our city management, our community for their support. And we ask that they continue supporting us 100%. And we're going to continue improving on this program for sure. And of course, our doc, who we couldn't have done it without him as well, because we work under his license.
Thank you, sir.
And if it wasn't for Doc, we couldn't be able to provide those services as well, because as you all know, if one of our medics or paramedics that is out in the field happens to do something, it's on him, right? It's on the medical director, because we rely on his license for us to allow to do the job that we do each and every day.
But I trust you guys, Chief, and I guess the jargon we use is on-scene performance, or on-scene performance, because of the integration that you mentioned, having the firefighters also be first responders, being ALS. Our on-scene performance has really excelled. And I think after 40 years, what I see specific about this program that really stands out is that there's a sense of community. There's a sense of pride. There's a sense of, we live here. This is our family members. These are not only the residents that we serve, but these are also our immediate family members. And so this is built, in my opinion, what I've seen here that I haven't seen in any other community, is that great sense of community and that great sense of pride of being part of this organization.
Thanks, Doc.
I think one last question, Dr. Melendez, is where do you see the future of Mission EMS?
So I see that as population continues to increase as rapid as it has, and the inevitability of having such a wonderful community that we live in, which is low in crime, high in access to jobs, cost savings, great quality of life. We're mentioned in the top 10 on almost all national. That with it, of course, one of the things we look at is healthcare. And the key to getting into the hospital, the key to access is EMS services. So I believe that this EMS service is only going to continue to grow and continue to be really the leaders in the field. I don't think we have a choice but to continue to grow.
There's one thing I do want to mention, and I would be, again, remiss. I want to thank my staff for the tremendous help and support. Not only that, but the initiative, the commitment, the dedication that they instill in themselves to make sure they get the job done, right? And so that's extremely important. My staff is pretty much your backbone of everything that we do. So I thank them for all the work that they have done. It's an outstanding amount of work that they have made this community safer and a better place to be.
Thank you, and rightly served.
Thank you.
Joey, any final comments?
I think everything that has been said way better than I can put it.
Okay.
Well, EMS, folks, where the rubber hits the road, what counts is what you do, not what you say.
There you go.
Yeah.
There you go. Thank you so much for being with us today on our first podcast for the City of Mission. I want to thank Chief. Thank you, Joey, Thank you, Dr. Melendez, for being here. Y'all brought some really, really good points to our conversation. Stay tuned for many more podcasts, and that's all for now. Thank you. Bye-bye.